Thank you, Mr Speaker. My question is to the Minister for Health and Wellbeing. Can the Minister update my community on the reason why patients at the aged care facility at Hammill House in Port Pirie were left with no power for several hours on Friday the 24th of October? With your leave that on the House, sir, I'll explain further.
Leave is sought. Is leave granted?
Thank you. There was a planned power outage at two of the stages to enable the new A&E building to be connected to the future of the hospital power system. The hospital wards were unaffected, with Hammill House and some other offices affected by the outage. There is no backup power for those areas. This resulted in discomfort for the residents, and the alarm bells were ringing continuously. There was no air conditioning, and elderly patients in electric beds unable to be operated. If oxygen was needed by a resident, this was not operational. There are 5 or 6 bedridden residents there. If planned power outages are planned in the future and are accounted for by using the generators, why was due diligence not done for the aged care facilities at Hammill House?
The Minister for Health.
Thank you very much, and thank you to the member for Stewart for his question, his advocacy in relation to Hammill House at Port Pirie. And obviously, as the member has said, we are building a new emergency department at Port Pirie Regional Health Service, which is obviously very significantly needed by the community to make sure that we can improve healthcare offerings to people in the Port Pirie region. In relation to the power outage that occurred at Hammill House, I'm going to follow up with the York and Northern Local Health Network in terms of what occurred there and what provisions were put in place, and to make sure that if there are going to be any future power outages, that we've got contingency plans in place to make sure that we can care for the residents of Hammill House, because obviously that needs to be the #1 priority. And I'll keep in contact with the member for Stewart, either in this place or privately, in terms of what we're going to do to address that.
The member